I am the co-founder as well as the Chief Technology Officer for Dozee. Dozee is a contactless continuous remote health monitoring solution that has sensors that go under the mattress. They don't even touch the patient and can get heart rate, respiratory rate and non-contact blood pressure with very high compliance when the patient is on the bed. Additionally, it can monitor more vitals like SpO2 and temperature from other accessories wireless. What the enablement of all of these vitals do is it enables us to create a AI-powered early warning system where we can identify signs of health deterioration in patients and alert the healthcare professionals, doctors, nurses in time so that they can take action. At King George Medical University in Lucknow, almost 1.5 years back, we started this clinical study where under an observational study, we did not change any clinical protocol of the hospital, but we collected data on 706 patients, close to for 85,000 hours of data. That itself is a big feat, collecting this much amount of vitals for patients in a tertiary healthcare setting, which is very, very busy, almost 90% occupied, and in a nurse to patient ratio of 1:36. In that, collecting these vitals in itself shows how, with very great compliance, Dozee can collect these vitals for almost 20 hours a day per patient without even bothering them. On top of this, we also showed that we can capture 94% of patients that required critical care, that required emergency critical care in these wards, in the internal medicine wards, up to 16 hours in advance. And while doing all of that, we have the potential to save 10% nursing time. The time that is spent in manual documentation, spot check, vital collects, and actually communicating them as well. Because all of this is collected on a minute by minute, digitally stored, and is available for healthcare professionals to look at in real time live, but also to look at later as well while they are reviewing their protocols or where they're looking at the trend of the vitals of a particular patient. So this greatly helps them in delivering better care to patients in the wards outside the ICU. It also helps in reducing costs as well by obviously saving time, but also reducing costs because less patients will end up in an ICU in emergency. So saving ICU costs, which is the most important critical resource of the country. Also, the patients that have been identified in time will actually spend lesser time in ICU and will require lesser critical care to actually recover and go back home.
And today I'm very excited to share some groundbreaking insight from our recent study conducted at King George Medical University. We evaluated the effectiveness of continuous contactless monitoring.
I'm a physician, in fact, and an intensive care physician. Now, why we planned this study is that what I most importantly need is just two things. One is contactless and second is continuous monitoring. Now, if a patient, think of a patient who is sleeping at the middle of the night and there is a blood pressure curve which is inflating and deflating in any residents or in fact automatic is going on, then that becomes very uncomfortable for him. So why we planned this study is one of the points is it was a contactless systems, and secondly I need a continuous monitoring system.